The RoWalker 400 is a platform walker of choice for any patient needing extra support, extensive rehabilitation, early progressive mobilization, cardio-thoracic, and abdominal post-surgical patients. Additionally, weekend oncology, CVA and neuro, elderly, and orthopedic patients benefit from the therapeutic benefits of this specialty walker. The RoWalker 400 has safety seats to allow patients time to rest. In addition, several accessories are available, including oxygen tank holder, baskets for medical equipment, suction apparatus, and an IV pole holder. The RoWalker has directional locking wheels, perfect for therapeutic gait training. The RoWalker 400 has a 400-pound weight capacity. In this video, we will discuss operation of the RoWalker 400, including assembly, operation, safety checks, troubleshooting, as well as care and maintenance. We will demonstrate proper use and care for your RoWalker 400. Be sure all components are included. The RoWalker 400 is made of the main walker unit and optional basket, as well as the left and right oxygen tank holders. The RoWalker 400 requires no tools for assembly. Let's begin step-by-step instructions for assembly. Step 1. Roll the unit out of the box. Attach the handles to the RoWalker with the provided locking levers. Make sure to securely tighten them. Loosen the vertical locks and pull the piston activator to ensure operation. If the oxygen tank holders were purchased, use the provided knobs to attach them to the appropriate side. If the optional basket was purchased, hang it on the horizontal crossbar. In this section, we will briefly review some of the operational features of the RoWalker 400, including proper use, all functions, and features of the RoWalker. Before using the RoWalker 400, all operators should carefully study and understand the instruction guides, as well as complete the RoWalker 400 competency checklist. In addition, the patient care plan should be reviewed for the patient's activity level and any contraindications for using the RoWalker. Ensure that the use of this equipment and accessories are in full compliance with the patient care plan. The RoWalker 400 has a height adjustable platform intended to allow the person to bear weight through their upper extremities as needed, and for special ambulation activities such as rehabilitation. To adjust the platform, release the clasp as seen here. Locking the wheels. The front wheels of the RoWalker 400 may be locked to inhibit movement. These should be locked as the patient is getting into position to begin use prior to walking. The directional locks on the back wheels may be locked for therapeutic purposes to direct intent of travel for the person using the device. To lock the wheels, step on the brake provided on each front and/or back wheel as desired. To release the wheels, apply pressure upward on the opposite direction until the lock clicks and the wheel movement is allowed. The RoWalker 400 should only be used on flat surfaces, and the patient should never be left unattended. Opening the base. The RoWalker 400 has an adjustable width base. This may be helpful with getting under and around furniture or allow more room for the patient during walking activities. To open the base, simply step down on the base control lever as seen here. To close, step down on the opposing lever, which will be in the up position as seen here. The base may be opened or closed during all phases of operation. Seat operation. The RoWalker 400 comes standard with safety seats. This can be used at any time the patient is tired and needs to rest. The seat can open two ways. You can lift the seat flaps as seen here, or the seats can swing laterally away from or to the patient. Always ensure the seat is secured and locked in place before allowing the patient to sit on them. The seat should be raised and away from the patient during ambulation. Accessories. The RoWalker 400 has several accessory options. We will briefly review them here. You can select the oxygen tank holder. This will hold a standard oxygen tank. Secure the oxygen tank in place and lower completely into the holder prior to walking the patients. Ensure the oxygen tubing and any lines attached to the patient are safely secured. In addition, an accessory basket is available. This has a 60-pound weight capacity. A portable ventilator, heart monitor, or other medical devices may be placed in the basket during use of the RoWalker. All equipment placed in the basket must be under the 60-pound weight capacity and secured in place prior to walking the patient. Finally, a suction apparatus and IV pole holder are available. See the product manuals included with the accessories for complete product details. For safe and trouble-free operation of the RoWalker 400, there are some routine procedures that should be performed prior to each use. Visually inspect the walker and check for any external damage and wear. Check that all bolts and joints are tight. Check that the clasps for the platform adjustment are present, movable and secured after adjusting to the desired height. Check the brakes for proper function and test the seats for proper function. Test any accessories for secure placement and function prior to use. For any troubleshooting concerns, first consult your product guide. If you have further issues, contact your maintenance or biomed department. If not available, contact your local distributor or contact the Handicare National Service Center via phone or email. Routine cleaning of the walker should be done with common surface disinfectant such as water-based ammonia compounds or quaternary compounds. Do not use products containing phenol or chlorine, since the nylon parts may be damaged. Assure that the wheel casters are free of dirt and hair. The RoWalker 400 should be thoroughly inspected and serviced when needed, at least once per year. Perform complete weight tests and pay particular attention to the parts that show wear, such as joints, bolts, welds, wheels, etc. Service must be carried out according to the Handicare service manual and by authorized staff. Repairs and maintenance may only be done by trained and certified personnel using original parts. When storing, keep the walker at a temperature above freezing and relative humidity no more than 60%. Taking the time to remember these simple procedures will pay off in years of safe and comfortable operation of the RoWalker for you and those you care for. If you have any questions or comments, please consult your local distributor or Handicare specialist.